Thank you, Janaea, for being with us today. To initiate our session today, we just kind of wanted to set the tone and we're going to launch it with a poll. So, uh, everybody that is able to see the screen right now, if you could participate in answering this question. Our very first question is: I feel the pandemic response has been handled appropriately at the national level. And so this is anonymous. Where we can't see who is answering it, but it's important for us to kind of gauge who is in the audience. Um, and you'll understand why we're asking these poll questions as we move through the session. So we have about 4 people that have participated, so thank you. And so we're on both ends of the spectrum. We have some that yes, they agree, and then others that disagree. So around 83% or 86% say that they disagree with the pandemic response at the national level. So I'm going to go ahead and end the poll. Thank you so much for participating. I'm just going to share the results with you here. And it's important to kind of gauge who's in the audience just so that we know how to answer and review our information. Know that once research is created, it's kind of hard to translate it into a form in which we could all understand. And so you'll understand with the information that we provide you today. Why it was so important for us to disseminate what we found. So, the objectives for today is to be able to describe how our graduate level public health students perceive COVID 19 information, to describe how perceptions of misinformation impact seeking services like health services amongst the Latinx and Black communities, and finally, to describe Latinx and Black students' perceptions about the local, state, and national response on COVID-19 pandemic. So you could see there one of the questions that we just asked was at the national level.
Thank you, Dr. Dulce. Greetings, everyone. Thank you for participating with us. Before we get started or I jump into the slides, I would first like to pose a question, and you can give your response in the chat. And actually, so that will make this a little interactive. Would love to know just kind of how what were your thoughts when you first heard about COVID-19 when it first came on the scene? So we heard about it. We heard a snippet about it in December of 2019, and then January 2020, it started to become a little bit more of a hype, but it wasn't really until March of 2020 that it really hit. So in that time frame, what were your thoughts? How were you feeling? Were you feeling like, this is going to affect me in X, Y, and Z way? I'm concerned about my family. I really don't know what this is, but it is very confusing. I feel like the information is not being given to me accurately. Give me your thoughts. Give me your feedback. What were you feeling when COVID-19, shall we say, hit the scene? I'll be interested to hear or to read, shall we say. Yeah, anxious. Absolutely. Yes. Uncertain. You are absolutely right. There was a lot of uncertainty and nervousness. Absolutely. Yes, scared, valid, absolutely. I mean, just unsure. So now, with all those real feelings, let me walk you through a little bit of the college student's perspective. So again, I am a student in the public health department at Grand Canyon University, completing my master's degree. But with that being said, I'm virtual. And I actually live in San Diego. So there were actually two thoughts and feelings for me. So one was to support my virtual school family, but then I have a physical family that was certainly concerned about. So let's take a look at the slide. So we're at COVID-19 and college students. So there was a lot of concern regarding access to information regarding COVID-19. So again, is the information that we're being provided accurate? Or who do we go to? Who do we turn to? Where am I going to get the truth? Absolutely. Those are great response. Thank you guys. So what does that look like? What did student access look like? And what did it look like for me, say virtually? What does it look like in person? So imagine being on campus and that thought of where am I going to get accurate information? So again, I'm going to take you back to March of 2020. So we didn't really start getting good, solid information until about February, end of February, March, and then, feeling like the National Guards are coming in to make people stay home. It was a very, very confusing time. And then students' access to personal protection equipment. Where were students getting gloves and masks? And, I know for a moment, I felt like my whole family needed a whole hazmat suit because either the media or government, either locally, nationally, were putting out the scare factor, or they were too lax. So you didn't know, should I walk around in a hazmat suit? Where do I get gloves? What's the right kind of gloves? Where do I get these masks that everyone's talking about? Where is this accessible as a college student, both virtually and in person? Where do I go? Who has it? COVID-19 testing on campus. So again, I hate to keep drilling in, but it wasn't until March really that this was real. So imagine from January to March, what did COVID testing look like? Where did I go? Who did I contact? Where does this start? So as a college student, this was extremely confusing because if you look at the outlets in which information was being disseminated, it was either Facebook, social media, Instagram. And if you were one of the really lucky college students, you had a TV in your room or so it depended on where you got the information, which determined how you were feeling about COVID-19 in that time. Where was I getting access to the PPE? And on campus, where was the COVID testing and how valid was it, right? Because it just happened. COVID happened. So how long have we been testing this COVID test? And then we go down to safety measures on campus. What did that look like? For COVID-19, you don't necessarily call out a security guard. So what is safety measures on campus and who puts them in place? Who makes sure the information gets out there? Who's who? What's what? Again, safety measures on campus. Okay, so who's washing the arm rails as we're walking up and down stairs? Who's washing doorknob handles? How is that happening? So these were all concerns, valid concerns, just as your concerns that you listed in the chat that college students have. Next slide, please. So now let's look at our Latinx population. Of course, there was a hesitancy about the government and the health system. And we wonder why. Why was there hesitancy? Why was there distrust? Well, the hesitancy can take us all the way back to the 1930s when in Puerto Rico, and you had the public health structure go and provide sterilization as a form of birth control. Really? And these women were not aware that that's what was happening. So once you have something of a nature that happens in a community, so we are going to reference Latinx as a community. So yes, it happened in Puerto Rico, but it's not too far from the Latinx communities worldwide. So we still want to say that would cause the hesitancy about the government and the health system. How much can we trust you? How well are you giving us the information? And then we look at distrust due to information not being in shared native languages. It wasn't until about March that COVID-19 information was in another language other than English. So imagine that. If English is not your native tongue, but you're being expected to understand what's going on, but the information is not relatable. You don't understand. Yes, you see pictures, but what does a picture tell me? It doesn't tell me how serious this is. So of course you have, Latinx college students probably trying to relay the information to their community in a language that they can understand from a trusted individual because you look like me. So I'm sure you're giving me the right stuff. But when the information is not being disseminated in my native language and individuals don't look like me, that is very confusing. And that would cause a lot of distrust so that I'm not really, sure how much of this I'm trusting. And then not being tested with fear of deportation. Well, of course, how much of your private information do you want to share if there's a possibility, or in your mind you're thinking, because now we're dealing with trust issues or mistrust, that you may be deported and you have an entire family that you have to think about. So no, I'm not going to get tested. I mean, give me your thoughts on that in the chat. In the chat, give me your thoughts. Do you think that deportation would be something that would be considered? Because I certainly do. And even we'll see further that there is some mistrust and some hesitancy or reluctance. So now we moved on to COVID-19 and the Black population. Information not being communicated appropriately. So once again, how is the information being shared? Are you talking on my level? So if you have particularly many lower socioeconomic communities consist of Black people, African Americans. I mean, that is historic. So if I was to even take you back, historically, we didn't ask to be here. So yes, a lot of our lower to middle class is going to consist of Black community. There's a lack of trust. The information is not communicated on a level to which a lot of African Americans, Black, older, they can't read, or they read at a very, very low level. So if the information is being disseminated over our head, if it's talking in terms that I don't even know what you're talking about, then guess what? I'm not even going to read it. I'm not going to listen because I don't understand it. So, but if we brought down just a little bit in terms of what this means, I always feel like when you're looking at giving information to a community, it needs to be in grade school level. So my sixth grader should be able to pick this up and understand either by picture or by simple words what this is telling me. And then, so that takes us to the next point of information sharing differing based on socioeconomic status. So that is something to be very mindful of. Now, of course, I would be remiss if I didn't mention the history of misinformed information by the government. So if I take you to the Tuskegee syphilis experiment, back again, early 1930s, so 1900s, 1930s, you have 400 to 600 men who were told that they had syphilis and that they were going to be treated and they would have a monetary compensation on top of medical care, on top of their family being well taken care of, which was not true. That is very unfortunate. So now, let's go through syphilis, then let's go to smallpox and everything in between. And now we're at COVID. So now you want me, Black woman, Black population, to trust what you're telling me when you have proven that the information is not correct or accurate. So I'm fortunate that from me and my village, we come from pretty well educated individuals. But for those who are not, there's a lot of mistrust. So here in San Diego, I really am boots on the ground as far as educating the older African Americans about the importance of being vaccinated, of COVID-19, and really breaking it down. But I'm going to take you to college students. So most college students are not my age. So you got 18, 19, 20. So that means that they have that history is fresh in their mind. They are getting it It just happened. They just read it. They just understood it. So yeah, right now, excuse my French, they're still a little pissed off by what they read. And so now COVID comes and they're like, wait a minute, I just learned about this whole syphilis experiment. And now you want me to trust that you're going to do right by me? Oh, no. It's not happening. And we will see that as Danielle presents the data and presents how we furthered in this study, that there were moments of not trusting you on this one. So, with what I provided you with, I think that the data will back up the reasons why Latinx and Black community, particularly amongst college students, felt the way they do. If you have any questions, please don't hesitate to drop them in the chat. Thank you.
Thank you, Janaea. So you set the stage for us and really making us realize why, as professors in the College of Nursing and Healthcare Professions, we embarked in this and took the opportunity that the pandemic has brought us to really learn what students are thinking, their perceptions, and because our platform, we're an online platform, we have a wide variety of students across the nation. So, the objective of this study was to assess the perceptions of the COVID 19 pandemic and how it was being handled. So, as Janaea said, think back to 2020 in the initiation of the pandemic because it wasn't declared a pandemic until well into March. So, we're going to set up another poll. And polling for us is very important because then we can continue to gauge how you're feeling about the presentation thus far and then learning about the results from our research. So, the second question is, I feel the pandemic response has been handled appropriately by my state. So, like Janaea is in California, but some of you may not be here in Arizona. So, again, this is anonymous. We don't know who's answering the questions, but we appreciate you taking the time to answer the question. So again, if you could fill out the we have 6 responses so far, 7. So we'll go ahead and close it out now, and you can see the responses. We had 9 participants, and so 22% of you said you agree, and consistent with the very first poll, over 50% of you said you disagree on the pandemic response by the state. So, wherever you may be residing, that's how we're looking at this question. So, the participants were all public health students in all phases of their Master of Public Health curriculum. In exchange for the survey completion, faculty awarded credit for weekly participation. So, we were able to disseminate this information so that not only Professor Danielle and I disseminated in our platforms in our classrooms, but we got other public health faculty involved so that we could get a wide range of students in different um, parts of their 2 year program to participate. Because you may have a different perception if you're just starting out your MPH program, if you're towards the end, because you have a lot of theory in between those 2 years. So the survey instrument we developed utilizing Qualtrics and we administered it to all the online professions and only we separated the data to only utilize public health students because we did disseminate it to all nursing programs and a variety of other students in the healthcare professions. And so this data was collected between November 23rd to December 12th. And so that's a very important information point so that you could think back to 2020. Janaea really set the stage for what was occurring at the very beginning when the pandemic was declared. And then, so now these students are taking this survey between November and December. And all of it was anonymous and confidential. we also put on the slide kind of what the survey looked like for the student on the online platform. That's also important for us to know, like, well, how did you participate? Was there a link? Did you do it by paper? No, so this was all online, and again, it was anonymous. They did receive a participation point. So the incentive was not monetary, but it was for their schooling. We had three survey questions. We had more, but for this manuscript, we only looked at three survey questions. So the first one we are already answered here in this platform. I feel the pandemic response has been handled appropriately at the national level. The second one, which you already answered as well, I feel the pandemic response has been handled appropriately by my state. And lastly, I trust my local health officials to respond to future pandemics appropriately. And all of these were on a Likert scale, just like how you have taken the poll today with agree, don't know, or disagree.
To analyze the data, we conducted descriptive statistics to assess the student perception at the national, state, and local level, as we've been describing. Since we really focused on the Latinx and Black communities, we recoded the race variable first into 4 categories. We had white, Hispanic or Latinx, Black, and other. And then for further analysis, we regrouped that variable into 2 groups with white and other. All analysis was conducted in SPSS version 25. We did submit the study for IRB approval and it was determined to be exempt. So let's talk about the results. What did students say? Here are our demographics. So 81 students were included in the total sample. 12.5% identified as male and 87.5% identified as female. 86.3% stated they were in the first year of their program, which is important because earlier we were talking about the continuum of a graduate student. And so here we know that most of them were in that earlier phase of the curriculum. This pie chart breaks down the race variable. So it shows that 29.6% of the students identified as white, 28.4% Black or African American, 24.7% Hispanic or Latinx, 6.2% multiracial, 3.7% Asian, and 1.2% Native Hawaiian or Pacific Islander. Given that this is an online program, our students can reside all over the United States or really internationally as well. So we wanted to provide a breakdown of where our students live based on the census regions. So 67.9% of our students resided in the West region, 17.2% in the South, 6.2% in the Northeast, 4.9% in the Midwest, and 1.2% in that Pacific region, which includes Alaska and Hawaii. So let's talk about the results. Once again, we have those 3 levels, national, state, and local. So we will start at the national level. So we wanted to look at the percent who agreed to these statements. The first being, I feel the pandemic has been handled appropriately at the national level. So in this first chart, we're comparing white, Black, Latinx, and other students. So we see that at 26%, white students agreed. So 26% of white students agreed with the statement compared to 21.7% of Black students, 14.3% of other students, and 5% of Hispanic or Latinx students. And when we looked at the same data, only grouping the race variable into those 2 categories, white and other, we see that 26.1% of white students agreed versus versus 14% of other students. At the state level, we had that same question. I feel the pandemic has been handled appropriately by my state. And we once again looked at the percent who agreed to that statement. So we can see that 60.9% of Black students agreed, compared to 39.1% of white students, 28.6% of other students, and 15% of Latinx students. When we broke this down into those two subcategories, we had 39.1% of white students in agreement compared to 36.8% of other students. Then lastly, at the local level, our question differs slightly. We asked students to agree or disagree to I trust my local health officials to respond to future pandemics appropriately. So for this question, we had 69.6% of Black students agreeing compared to 65.2% of white students, 57.1% of other students, and 25% of Latinx students. And when we broke this down into two groups, you can see that white students agreed at 65.2% versus other students at 50.1%.
So you could see why it's so important to kind of review the data. Most of our students, 50% of the students were between the ages of 22 and 30. So you could see the mindset. And also, it's important to see these are public health students. So we know that they're going to be practitioners or already practitioners in any type of setting, whether it's in the community, nonprofit. It's very rare when we get students that are not already working in the field. So why is that important? Why is it important to kind of translate that information of what their perceptions are? Is what will they do in practice? How will they share this information? Will they take advantage of dismantling misinformation or disinformation in our communities, utilizing social media, utilizing the online platform, and really being able to relay information accordingly and appropriately to what they're taking in from their Masters of Public Health curriculum. So that's very important to us as professors as we move this information forward as we're in the classroom on day to day. So the reactions may differ based upon race, with the response of Black and Latinx participants differing from others. And remember, those others were those individuals, they may or may not have been identified as Black or Latinx, but they just didn't identify that way in our research. So students of color disagreed with the pandemic response at a higher rate than those white students. And so take us back to what Janaea was discussing. What are their internal biases? What has their historical context for their families have been? You know, are they newly integrated into the United States? Were they immigrated? Were their parents migrants? So then you live that historical trauma and you tend to bring it into your workplace. And so that's important again for us to really be able to dismantle that and really ensure that public health students both at the undergraduate and the graduate level assess that internally, but then don't disseminate that and really put that um, good best practice forward of really dismantling information. So, when asked about trust in the US to respond to future pandemics, because we know that history repeats itself, and yes, we will see other outbreaks and future pandemics because we've seen it with SARS, with H1N1, with cholera, and I could just go on and on about all the different outbreaks that we've had. We know we will see it again. So, we saw that there was a gap between Black and Latinx participants. So, where is that coming from? A similar trend was seen when assessing the pandemic response at the local and at the state level, with the higher percentage of Black students agreeing in comparison to Latinx students. So we have a couple of questions for our future research is, do Black students have more trust in national and state government than Latinx students? And if so, what are the reasonings behind that? Are there certain factors? Or is this just an isolation or out of, a kind of like an outsider um, response that we found in our research. Why is that the Latinx student population has more trust at the local level when we're comparing it to the state and national level? And we can look at things like rural or urban cities. And what impact does the community have on the results? Do the results differ by region or by state? So That's critical to know because, as you know, we're still living through a pandemic. Each state, each municipality, each county has a different response and things that are being enacted and put into policy when compared to the rest of the nation. We did find some limitations. Remember that these are Master of Public Health students' responses uh, when we need to see the comparison of non-public health students. Now, do they think the same or not? So we don't know because we only surveyed healthcare professionals, and for this manuscript, it was only public health students. And it was a low sample size in comparison to looking at the national level. Again, it was 81 students and informational statistics were not conducted. So, therefore, we didn't see a cause and effect relationship. So, that's important in the future that we could see if there is a cause and effect once the pandemic is over, maybe doing additional research into seeing if one thing caused another. So we have another poll. I know that was a lot of information that I just went over, but again, if you have any questions, go ahead and put them in the chat and we'll try to answer them. But here's we have two more polls. This is the second to the last one. So I trust my local health officials to respond to future pandemics appropriately. So we ask that you answer it, having taken in everything that we just discussed on what our students were perceiving towards the end of 2020. We're almost a year out from when we initially started this research because we conducted it in November of 2020. So thank you for participating. Here are the results. Um, 67% of you agree. So now it's like really a shift from the first two questions. And some of you just don't know. And that's valid as well. So there's no right or wrong answer for this poll. And then lastly, the last poll that we want to share with you and have you answer is, I trust the US to respond to future pandemics appropriately. Now, this question was not included in our results or our research for you today, but it's important that we also look at the national level with all of the information that is going on right now, again, with policies and different procedures being handled at the different levels, again, local, municipality, county-wise, state-wise, with different job sites, whether you're a healthcare worker, whether you're a healthcare profession student under the umbrella of nursing, they have different requirements. So academia is really all over the place on the requirements. There's not one solid statement out there of what's required for college students, especially now that we're on the online platform for most of the students in public health right now. So I just ended the poll, and here are the results. So we have a variety. We see 11% of you agree that you trust the US will respond to future pandemics. Some of you, 60% of you said you don't know, and then 22% of you disagree. So, thank you for answering and being very candid and transparent. We don't have all the answers. We hope that we've learned many lessons throughout this pandemic and that our future response can be better than this last one. Uh, do you have anything to add, Danielle or Janaea? As we close out, we have a couple of minutes left for you to ask any questions, any clarifying questions or ideas about our research. The QR code is here. It's for the evaluation, and it's also in the chat. Anything to add, Danielle or Janaea?
I don't have anything to add. I think that the information and the data really speaks for itself in terms of like, and pretty much like you said, another pandemic is on its way. I mean, it is what it is. And I'm hoping that as nationally and the state, and again, like you said, every state handles it differently, and however the government, that they will continue to mature in these processes so that we don't run in circles the way I feel like we did for COVID-19. I don't understand why we ran in such circles when we experienced it during H1N1. So there was a lot of confusion, and I'm hoping that as we learn and we grow through situations, that we absolutely will have better outcomes.
Yes, I agree with you. Erin, you say that confidence depends on the leadership at the time. And yes, we've lived through the pandemic two administrations at the federal level, and some of us at the state or local level have switched over to different administrations. And I completely agree with you. And so, setting the stage for public health students right now to be able to build that confidence in our communities, especially our communities of color, is so crucial and so important for us as faculty to be able to take this research and then translate it into the classroom to be able to help students learn what their internal biases are, to then turn that over and make our communities even safer, healthier, and being able to assess and address those inequities, or how do you deal with all of those perceptions so that we can dismantle the rhetoric that's been a part of our lives, as Janaea, provided that background for us. So that last question about the trust at the national level, we didn't share the information, but we're writing a manuscript, so we hope that you'll be able to read that, in the years to come, and how to utilize this information when you're writing a grant or you're seeking out information on public health students, especially at the graduate level. Did you see any questions, Liliana, in the chat that I might have missed?
We don't have any new questions yet. Feel free to drop your questions here. We have some more time.
I think I'll just add that one unique thing about our research is that not only is it with students, it's with public health students. So these students are studying and living through this at the exact same time. So it's such a unique perspective, and having access to this student population has been great for us to be able to not only do research, but to talk about with our students. So it'll be interesting to see what this next generation of public health students looks like and learns because of this experience. So if you have any questions about our research or any ideas, please feel free to reach out to us, because we're always, looking to see how we can do more.
And I do have a question. Do you plan on expanding your research to outside of public health students? Is that something that you're planning on doing, or for your next research about the pandemic? Are you planning on, doing surveys with other type of population?
Yes, we have a current manuscript in review from earlier this year because we did do this with another university across the nation. And so in that research, we included other healthcare professions like occupational therapists, pharmacy students, nurses. And so we had a variety of other healthcare professions, and then being able to compare that with public health students, because public health students have a really a unique perspective, because it's all kind of interconnected with all of the other healthcare professions, and kind of seeing the broader outside of the box, because they're public health students are not clinicians, and so other healthcare professions are. And so public health has that ability to kind of be interconnected with all of these other professions. And so we we hope that our manuscript is accepted, either later this year or well into 2022. And so, yes, we have included other healthcare professions.
Awesome, thank you. We just had a comment. This was very informative. Thanks for the information.
Great. Sometimes we have a really robust set of participants where the questions are just, a lot. So we didn't include a lot of the analysis in this presentation. But if you'd like to get more of, the nitty-gritty of the results and the details of all of the different tables, we're more than willing to share that with you because it is important, especially when you're writing grants or seeking out, disseminating information about what's going on at the national level and at the state level. So you can always reach out to Danielle and I to provide that information for you. So thank you. I know we ended 4 minutes before 2:30, so that'll probably give you enough time to go and take a mini break before the next session.
Yeah. So feel free to stay here. If anyone wants to network, ask more questions, feel free to turn on your camera. You can stay here till the next session starts, or you can go to the next session and wait until the room opens up, or you can also go to the virtual poster session. The link is along with all the other links on the document for the conference. So there's options. Feel free to stay, go join your next session, or go visit the virtual poster session.